Hello, so today we will talk about lockdown, diabetes, and Ramzan. What are those 10 important points that every person or people living with diabetes should know about lockdown and Ramzan? This is called as structured diabetes education for Ramzan, and which is very important for all such people. There are 10 such points that we need to understand and we need to remember them. Point number one, the core principle of Islam is help our fellow human beings, where most of the festivals in the world in the last 4 months during this COVID pandemic have been celebrated at home. We should also work from home as well as worship from home. The reference is from Hayya ala Salah. Now there is something called as As-Salatu fi Buyutikum, which means prayer in home, which was also done in earlier or decades when there were issues with Waba-like illness or this pandemic-like illness. This is point one. Point two, there are four kind of complications that a diabetes person may have during fasting, which is one, hypoglycemia, low glucose; two, hyperglycemia, glucose can go high; three, dehydration and thrombosis; and four, diabetic ketoacidosis or extreme hyperglycemia. Point number three, there are four risk categories for diabetes and fasting. These are low risk category, where the patient or the person may only be on diet modification or on a small dose of drug called as metformin, or moderate risk patients who can be on certain smaller acting kind of tablet or drugs. And then you have high risk and very high risk. In high risk, you have people, those who are having uncontrolled moderate hyperglycemia, or they have a kidney problem or a heart problem or stroke, that is called, or you could be at very high risk of fasting, which are these following: a type 1 diabetes, recurrent hypoglycemia, recurrent low glucose, or admission for a diabetic ketoacidosis in the last 3 months, or pregnancy. These are important. So when you talk to your doctor, you have to understand your own risk categories. There are many benefits of fasting. That was point 4. So apart from the spiritual benefit of fasting, there are also benefits like there is a detoxification of the body. So whatever we've been eating in the last 11 months, now we'll be eating kind of different and a lesser amount of food, which will help the body to rejuvenate. Then there is something called as integrity or taqwa that we learn during Ramzan. This also builds a healthy bloodstream. There is increased energy. There is weight loss. Yes, if you really perform all the duties and everything in Ramzan properly with structured education, we can lose up to around 3 to 6 kg of weight. Then there can be benefits like therapeutic fasting, which is also being tried in obesity and diabetes, but of course under medical supervision. Now this is important for us to know because Islam exempts few people from fasting, and these are if person is ill, or fasting will harm your body, extremes of age, a lady in menses or pregnant, or if you are traveling. So these were the first 4 points. Number 5 is what should be the target of blood glucose and why we are talking about this. Because in Ramzan and because there is fasting, there are changes in food, there are changes in activity, and there are changes in the sleep. That's why we will first talk about food, and we will name it as food with family. So the Sehri part we will take Sehri as late as possible, especially with complex carbohydrate and fluids. So complex carbohydrates could be your roti or your rice or bread, depending on where you stay and what is your local cuisine like. Then you have a protein. Your protein could be either milk, it could be a dal, it could be egg, chicken, or whatever is available locally and is allowed during your fasting as per your diabetes treatment also. Then we have in the evening iftar. You can have 1 or 2 dates. Each date of a medium size gives you around a teaspoon of glucose, and it gives around 20 to 24 calories, followed by you could have either water, or you could have sabza seeds in the water called, or takmaria water that we called as, or you could have infused water, or you could have buttermilk, or you could have lassi without adding sugar, or you could also have a mild, simple drink of milk with any added flavor as per your local cuisine. So this is iftar, and after this either you pray or you have an added snack or an added item, which is preferably either boiled or grilled or poached or roasted, so that it's easier for us to digest and eat. Now, there are two types of people, those who have either 2 meals, sehri and iftar, or some people also have dinner. So those who have dinner, they can have a moderate dinner at around 9:30, 10 o'clock, so that there is enough time for us to digest the food and be ready for the next sehri the next day. And because we want to eat sehri as late as possible and as good as possible. Apart from this, the next comes the point number 6 is exercise, that all of us should know. Yes, exercises are allowed in Ramzan, and you can do it especially 1.5 to 2 hours post iftar. Now this exercise could be your indoor exercises, whether spot walk, spot jog, simple planks, or they could be squats if you are allowed to, or if you are a regular heavy exerciser, you could do those 2 hours post iftar easily, but do it at home in lockdown situations. Point number 7 is monitoring of glucose. Yes, monitoring of glucose with your own home glucose machine is allowed, and you could do this for low glucose or to detect hypoglycemia. One is any time, but specifically after 1 p.m. or 2 hours before iftar or just around the time of iftar. And for detecting high glucose during fasting, the timings are 2 hours post sehri and 2 hours post iftar, to see whatever you've eaten, how much it is increasing your blood glucose. Point number 8 is medication. Remember, all Ramzan is not the same. The changes that have been made to your treatment regimen, tablet or insulin may not be the same every year. This year, summer is much more at peak. It is more hot, so you may need changes accordingly. So do talk to your doctor, your healthcare provider. In lockdown states, you might need to telephone them for telemedicine or an online consultation. Point number 9. Many people ask this question, when is it that I have to break the fast, or when is it that I have to stop fasting? So these points are important. 1, when glucose is less than 70 or you experience any of the symptoms of low glucose or hypoglycemia. 2, when there is high glucose, or that is when the glucose is at any time during fasting is more than 300, please call your doctor immediately about continuation of fast. And 3rd, and very important during lockdown, if there are any symptoms of COVID-19, fever, cough, breathlessness, rhinitis, or anything that you suspect, kindly immediately talk to your doctor, because Islam does believe in treating yourself and avoiding any kind of illness that you would have. And point number 10, and a very important message, that happiness is in the house, heaven is in our own home. Retreat with relatives. All the F's of fasting are important, which other words also become like family, friends, the fasting, the feasting, the festival, and you got to use it through this medium of phone, whether you text or you WhatsApp, whether you do a voice call or a video call. And remember, because we are in lockdown for a reason, to avoid the pandemic and disease, because there is a social distancing, give flying kisses to children and flying hugs to adults and elderly as needed, and be safe and have a happy Ramzan. Thank you so much.